Welcome students. In today's topic we will see the mediastinal impressions of lung, root of lung, blood supply and nerve supply of the lung. Specific learning objectives of this topic that to give brief account of relations of mediastinal surfaces of right and left lung, write short note on root of lung, arterial supply, venous drainage, lymphatic drainage and nerve supply of lung. Now in this specimen of the museum you can see between the two lungs these mediastinal structures are there, including the heart and these great vessels, and these are creating impressions on the mediastinal surface of the respective lung. So here now first we will see left lung mediastinal impressions. Now this is anterior aspect of this figure, this is posterior, this apex is superior, this is toward the base of the lung. The cardiac impression on the left lung is by the structures which are on the left side of the heart, that is the left ventricle, left auricle, infundibulum and small adjoining part of right ventricle. Here in front of this root of the lung you can see this is the pulmonary trunk which is creating impression, and also left brachiocephalic vein will also be there. Then arteries you can see this is coming out of the left ventricle, that is the ascending aorta, then arch of aorta and then descending aorta. You can see it is arching over the root of the left lung. So these are related with this mediastinal surface. Then left subclavian artery and left common carotid, which are branches of this arch of aorta. They are also related at their initial beginning of this vessel with this surface. Then one tube which is in the midline, that is esophagus, it creates impression on both the lungs, right and left lung. Then here you can see on left side only the thoracic duct, which is the main lymphatic channel, is creating impression. Then there are three nerves which are related with this surface. One is left vagus, left phrenic nerve, and one is the left recurrent laryngeal nerve. It is homework for you, find out why the left recurrent laryngeal nerve descends into thorax and right laryngeal nerve do not descend. Now coming to the right lung mediastinal impressions. Now in this figure you can see the right sided heart structure, they are creating impression, that is right atrium, right auricle, small part of right ventricle, they are creating cardiac impression. Then the tributary of right atrium, these are the superior vena cava, inferior vena cava, they are creating impression. Then lower part of right brachiocephalic vein, then one of the tributary of superior vena cava, it is arching over the root of this right lung here, and it's entering into superior vena cava. So here it's creating impression on the above the root of the lung. This is the azygous vein. Then there are two tubes, that is one is esophagus and one is trachea. They are creating impression on this mediastinal surface. On this side only two nerves are related, one is right vagus nerve, right phrenic nerve. Now here this we just have seen the impressions or relations of mediastinal surface of right and left lung. Now diagram of mediastinal impressions of the right and left lung, you have to practice these diagrams. Coming to the root of the lung. Now here in this specimen you can see this is the root of this lung from which structures are entering and exiting the lung. Here this is the root of right lung and this is the root of left lung, and below extending is this pulmonary ligament, which is nothing but a parietal pleura surrounding the root of lung, extends downward beyond the root as a fold of the pleura. So this is pulmonary ligament, and above there is root of lung, and this complete structure is the hilum of the lung. Now root of lung is a short broad pedicle that connects medial surface of lung to the mediastinum and is formed by structure which enter or exit the lung. Hilum is a triangular non-pleural impression. So the pleura will be absent at the hilum, through which the structures of the lung root enter and leave the organ. Now, contents of the root of lung. Here you can remember a mnemonic, that is before backward VAB, that is pulmonary vein, pulmonary artery and bronchus. While above downward on left side ABV, that is pulmonary artery, bronchus and then the vein. While on left side, on right side, what happens? The right principal bronchus divided into superior and inferior. That is, one is above the artery, one is below the artery. So these are eparterial bronchus, then pulmonary artery, then the hyparterial bronchus, and last one is the vein. So this sequence you should know. And the other structures, other contents of the root of lung, these are these pulmonary plexuses of the nerves, lymphatics, bronchopulmonary lymph node and areolar tissue. Now this is the relations of the root of the lung. First we will see what are the structures at the root of lung. Now here the structures at the root of lung, here you can see this is the superior pulmonary vein, this is inferior pulmonary vein. On right side one is eparterial bronchus, one is hyparterial bronchus, and this is the pulmonary artery. Here small vessels you can see are the bronchial vessel. Anteriorly this yellow color is the anterior pulmonary plexus of the nerve, and posteriorly posterior pulmonary plexus. You can see lymph nodes, which are bronchopulmonary lymph nodes, and these lymphatics, they are also content of this root of lung. Now on this side, as there is only one principal bronchus, it is passing below the pulmonary artery. So sequence is above downward, pulmonary artery, bronchus and inferior pulmonary vein. While before backward, that is anterior to posterior, structures are arranged: superior pulmonary vein, pulmonary artery, and posterior most is the bronchus. So they are sequence above downward and before backward. Now this we have seen the arrangement of structure within the hilum, above downward and before backward. Now relations of the root, that is what is situated anterior to root, posterior to root, superior and inferior to the root. Now anteriorly both the roots of lung, they are related with the phrenic nerve, pericardiophrenik vessels and anterior pulmonary plexus of nerve. While on right side, in addition to these things, superior vena cava, in this figure you can see superior vena cava and part of right atrium, they are also situated anterior to the root of lung. Posteriorly, relations which are common on both the sides, these are vagus nerve and posterior pulmonary plexus of nerves. While on left side, descending thoracic aorta, it is related with the posterior aspect of root of lung. Superiorly, right root of lung is arched by the terminal part of azygous vein. While here, arch of aorta is above the root of lung on left side. Inferiorly, pulmonary ligament is the relation. So this is about the relations of the root of lung. Now coming to the arterial supply. Now here lungs are supplied by bronchial arteries as well as by pulmonary arteries. Now bronchial arteries supply nutrition to the pulmonary tissue and bronchial artery. On right side there is usually one bronchial artery and on left side there are two bronchial arteries. These are the branches of descending thoracic aorta on left side, and mostly the third posterior intercostal artery branch is given to the right side. Now pulmonary arteries, they are carrying deoxygenated blood to the lung. This is oxygenated and then it is returned to the heart by means of the pulmonary veins. There is a precapillary anastomosis between bronchial and pulmonary vessels which enlarge when one is obstructed in disease. Venous drainage from first one or two division of bronchi is carried by bronchial vein. There are two bronchial veins on each side. Right bronchial vein drain into azygous vein, while the left bronchial vein into the hemiazygous vein. Greater part of venous blood from the lung is drained by pulmonary veins. Now lymphatic drainage, all the lymph ultimately it is drained into the bronchopulmonary nodes. Now these lymphatics, they are arranged in two sets. One is superficial lymphatics and one is deep lymphatics. Superficial lymphatics drain the peripheral lung tissue lying beneath the pulmonary pleura. These lymphatic vessels pass around the border of the lung and margins of fissure to reach hilum and have numerous valves, while the deep lymphatics drain bronchial tree, pulmonary vessel and connective tissue septa. They run toward the hilum and then ultimately into the bronchopulmonary nodes. They are having no or very few valves. Coming to the nerve supply. Nerve supply of lung is important. It is, as the lung is viscera, it is having sympathetic and parasympathetic nerve supply. Sympathetic derived from 2nd to 5th spinal segment, while the parasympathetic is by the vagus, which is the 10th cranial nerve. Now these nerve fibers of sympathetic and parasympathetic, they will form a network, that is a plexus, first in front of the root of the neck, that is known as the anterior pulmonary plexus, and one behind the root of lung, that is the posterior pulmonary plexus. And then from the root of lung, it will travel along with the blood vessel and bronchi and will supply the substance of the lung and bronchial tree. Now parasympathetic nerve, when they are stimulated, they are motor to the bronchial muscle. That means the muscle spasm will be there and bronchospasm, so the lumen will be narrowed. Then secretomotor to the glands, that means the secretions will be increased. And sensory fibers, when parasympathetic they are stimulated, it will result to stretch reflex and cuff reflex. So when there is hyperstimulation of parasympathetic system nerve supply, it will lead to the asthma like disorder, while the sympathetic supply, which is from 2nd to 5th spinal segment, is inhibitory to the smooth muscle, so the dilatation will be there. Glands of the bronchial tree, they are also inhibited, so secretions will be less, and this will be favorable if we give the sympathomimetic drug, which are mimicking the sympathetic system. This, like adrenaline, it will cause this bronchodilation and relieve symptoms of asthma. Now this is about this topic. Thank you.